The contraceptive sponge or vaginal sponge is a 5 centimeters wide rounded piece of soft and pliable plastic foam that is moistened and inserted into the vagina to prevent pregnancy. The side that goes in first is curved inwards to fit around the cervix, while the other side has a woven polyester loop that facilitates removal. When fitted properly over the cervix, it creates a barrier that prevents sperm from passing across the cervix into the uterus. The sponge also contains a spermicide, which is released continuously to kill sperm. Putting in a sponge is similar to inserting a tampon. You can insert it up to 24 hours before having sex. After cleaning your hands, take the sponge out of the wrapper and pour on it about 2 tablespoons of clean water. Then squeeze it gently until it is completely wet and foamy. This activates the spermicide before insertion. With the curved part of the sponge facing up, fold the sponge in half and insert it, pushing it as far up as you can into your vagina. Then let go to allow it to unfold and cover the cervix. Use a finger to check if your cervix is entirely covered. The sponge becomes effective as soon as the spermicide is activated and it has been inserted into the vagina. Once it is in, you can have sex as many times as you want without replacing it. However, it is ideal that you remove it within 24 hours after inserting it. If you leave a sponge in your vagina for more than 30 hours, bacteria can accumulate, putting you at risk of toxic shock syndrome or vaginosis. For effective protection, you should keep the sponge in for at least 6 hours after each round of sex. Removal is easy. Insert a clean finger into your vagina and feel for the loop, then pull the sponge out gently. Each sponge is designed for single use only. Dispose the used sponge in a pit latrine or trash bin. With perfect use, the sponge is 91% effective at preventing pregnancy for women who have not given birth and 80% effective for women who have given birth. This contraceptive is a one-size-fits-all hormone-free method that does not require a medical consultation or prescription. The downside of using this method is that it requires high effort, self-discipline, and planning. If you do not feel comfortable inserting your fingers into your vagina, this method may not be a good fit for you. It is not a good option if you are allergic to sulfa drugs or spermicide. In addition, it may interfere with normal vaginal lubrication, making sex less fun. It is not advisable to use the sponge if you are on your period, has ever suffered from toxic shock syndrome, or if it is less than 6 weeks since you gave birth. A sponge will not protect you from STIs. To reduce transmission, use condoms. Learn more about the contraceptive sponge and other contraceptive methods by visiting findmymethod.org.